as we talk about the financial savings as well, I'd like to ask members of the panel how these savings compare with the cost of implementation of a computerized insulin dosing system. I know that this sort of an assessment has taken place in the past at Sharp Healthcare. Would you be able to comment on that for us, please, Rona?
Yeah, you know, when we were looking at EndoTool, obviously it's an expense that a lot of hospitals don't want to spend. But as we were looking at it, when I look at our data, the last couple of years, the cost ends up being, with the amount of patient runs that we have, just around $100 per patient. So that's not per day, that's per patient. One of the things that we were concerned about was nursing time, trying to do things prior to EndoTool, where it was paper protocols, people questioning each other. That was taking time away from nurses doing other things. So not only is it a very low cost for each patient for diabetes crisis, but it's also saving on the nursing end as well in terms of cost.
And what would you say the cost was per run? Were you able to?
It's about $100 per patient, so per run.
Okay.
And as you increase, as we increase the amount of people that we've got going on it, we've got 5 hospitals right now, more of our departments are starting to use it more, we might see that cost decrease easily.
Yes. Excellent. And when you think about $100 per run, if you're going to save half a day in the hospital,
Exactly.
that's a really easy equation. Moving on with you, Rona, a couple other questions. What advice would you give to teams trying to secure buy-in from nursing in particular to adopt glycemic software? I know often there's a real concern that, oh, this is going to be, additional training, additional clicks through the EMR for the nurse, another cumbersome system, potentially cumbersome system to learn. What would you advice would you give to nursing leadership with those concerns?
Yeah, when we were looking towards EndoTool, our outcomes were actually pretty good, but we were relying on nurses that had been around for a long time. They understood insulin drips. We were starting to get more of an influx of newer nurses that weren't trained in critical care. We were starting to worry that that was going to be time consuming on the nursing's time. A lot of times you were a little bit concerned with confidence. They would go to other nurses, talk about it. And when we really started to survey our nursing group, they were like, if we can just have something that we know works and that we can still use our clinical skills to see, is that something that would be right for the patient? It really has alleviated a lot of that unconfidence or unsureness of doing an insulin drip. And so that's really huge in terms of, you want to have your nurses confident about a product and that they're doing something correct for the patient. And then, like I mentioned before, the nursing cost, even if you take 15 minutes off of that day of a nurse doing this particular thing, trying to figure out how much insulin do I need to give somebody, how many fluids should I give them, that is actually quite time consuming, where EndoTool actually takes that away from them and allows them to just go through the insulin infusion.
Yeah, there's always a real concern about the cognitive burden on nursing for using an insulin infusion. And I know in my own experience, we had very severe limitations on using a dosing system instead of just a regular paper protocol. And by using that dosing system, we were able to use EndoTool throughout the hospital rather than just restricting it to a few patients on step down or within the ICU. And there's been we have another client, UPMC, that did a really nice analysis on the nursing workflow burden, and they're able to decrease the frequency of glucose checks by about 50%. So that's also a nice reduction in nursing workflow. If you're going to do it once an hour instead of doing it once every 2 hours, it's a nice improvement.
Yeah, exactly.
And utilizing EndoTool and improving the outcomes at your institution, has that made an impact on how diabetes services are viewed within your hospital?
Yeah, I'm pleased to say that we have diabetes teams in all of our hospitals, the majority of our hospitals, and our team has actually been the ones that actually do a lot of the nursing education, and we can provide the data that we're given by EndoTool itself, and we can really share how we can improve things. Late blood sugar checks, for instance, if we can make sure that we minimize that. That's going to help our incidence of hypoglycemia. Our hypoglycemia is pretty good right now, but we got to keep people on track. And this is one of the reasons that we do this, is that the analytics that come from EndoTool gives us a really quick bird's eye shot of what's happening at every hospital. So it really is true that the diabetes team is now looked at as the experts in insulin infusions. So that's really nice.
And your diabetes team, has there been any conversation about expanding for the sub-Q application of EndoTool?
Yeah, you know, it becomes a financial issue, but I think our sub-Q problem is worse than our insulin infusion was. So we're looking at how do we look at a product such as EndoTool going into the sub-Q area, because it does alleviate that concern for a nurse. I'm looking at a blood sugar. What do I do? And so if a tool like a sub-Q EndoTool is there, it will help them be a little bit more confident for what they should do based on the orders that were already given.
And hopefully fewer calls to the provider and
Exactly.
So a question to our panelists. How have you seen EndoTool impact nursing workflow in your system? Dr. Schowski, I'll pick on you. Did the improvement in workflow at Elkhart achieve further support from nursing for expansion?
Oh, most definitely. You know, it was, as we were going through our decision-making process, one of the things that we just informally did was collected some essentially testimonies from our nursing cohort that had been using EndoTool, and just simply asked them the question, hey, what would you think if we stopped using EndoTool? And the resounding response, I mean, it was almost a visceral response that, why would you ever take that away from us? It's made our lives so much easier. And so being able to share that sentiment from the nursing, essentially every nurse that ever was managing an insulin infusion at that hospital didn't want to practice at a place where they didn't have EndoTool already in place. And so having our nurses from other hospitals talk to the nurses that we had at Elkhart General made it a very easy to get folks on board as we were preparing to go live with EndoTool. And we actually happily just went live about a week and a half ago at four of our other hospitals with EndoTool IV, and the reaction from the nursing leadership and just the nurses that have been involved has been extremely positive, just because of the ease in which it takes a previously complex workflow and really simplifies it and frees up that cognitive burden that used to be dedicated to manually managing that insulin drip. It really allows them to focus on other things. So these are, you know, obviously very sick patients that tend to have a lot of comorbidities. Managing the insulin infusion and all the things that go along with it took up a lot of brain space for the nurses. And so giving them an automated tool that allows them to focus on other things while at the same time taking really good care of these patients from an insulin infusion management perspective made it a very easy sell. So it was kind of the triple win. All of the nurses and the physicians who answered that question, that testimony question, what would you think if we took it away? And I'll never forget one of the ER docs giving me one of those looks like, why would you do something that dumb and take this away? It's like one of the things that actually helps us with regards to technology. So you know, having a product that improves the lives of the clinicians that are taking care of patients helps us actually do a better job and a more safe job taking care of those patients, and produces a financial ROI for us, just makes it really easy to roll it out. And so we're in the process of implementing another 4 hospitals onto our electronic health record, and are already in plans for making EndoTool a part of that go live. And I think it will be just as well received.
As far as, well, thank you for those comments. That's really
Sure.
astonishing. I'll go to you, Alice, and ask you, because you spent a lot of time in the ICU as a critical care pharmacy specialist. How's this impacted the workflow for your nurses there?
I would really reiterate a lot of the points that others have mentioned already. The dosing is incredibly straightforward relative to what I've used at other institutions where I didn't have EndoTool, and I think removing that calculation step is definitely time saving and also improves patient safety overall. We have also been quite pleased with the safety feature to essentially predict a hypoglycemic event before it occurs. It has been triggered every now and then for some of our patients to even prevent that from occurring, and it serves as a nice clinical reminder to the nurses who are certainly being vigilant on their own, but that it appears that something is changing with this patient's anticipated glycemic trajectory. And we're going to make this change, and we've kind of been able to do more training on that so that we could also, pull in a clinician if any need were to arise for further addressing of that. And then obviously the little alarm bells make dosing reminders very simple. I know when someone's on EndoTool right away when I walk in the unit. And I think all of that automation really removes a lot of burden and ultimately improves patient safety. And we have also observed the decreased time to resolution of hyperglycemic emergencies like DKA.